Okay, thanks very much for and welcome to the NIHR Healthy Aging Policy Research Unit webinar today. Today we're going to be looking at the issue of addressing physical activity amongst adults in mid to later life and looking at some of the challenges and strategies. This is part of our series of webinars from the Policy Research Unit in Healthy Aging, which we've been doing in partnership with the Dunhill Medical Trust, the ARCs, the Applied Research Collaborations, and with Newcastle Biomedical Research Centre, and organised by Newcastle and University and the University of Manchester. And we've been showcasing the work of some of our PhD students. And so this is the third of those showcase webinars. And today we have two presentations. The first one is Danielle Harris, who will be talking about the effectiveness and acceptability of physical activity interventions amongst older adults, with a particular focus on socioeconomic factors and looking at socioeconomic status. And the second of them will be from Lily Mott, who will be telling us about how we interrupt sedentary behaviour in older home workers. Now then, before we start, a couple of housekeeping things to do. We're recording the webinar today. That's just so that it can be put up on our YouTube channel later, so that people can look at it at a later date. Throughout the webinar, we're going to post related research and comments into the chat as we progress. So recent publications and things like that will appear in the chat. Now then, for each presentation, we're going to have a chance to have some questions and answers at the end of each presentation. And you'll see somewhere on your screen, depending upon what system you've got, probably at the top, you'll have a question and answer option where you can post questions, as well as give a thumbs up to any questions posted by others which you agree with. However, we know from experience that not all machines have got this question and answer facility set up. It seems as if some of the firewalls, some of the what do you call it, sort of web based security systems don't allow the question and answer. So if you can't access question and answer, please just use the normal chat function to put your question or your comments into it, and then we will try and pull those questions up and ask them at an appropriate time. So if you can't see the chat function either, suggest that probably you do the time-honoured thing with IT, turn your machine off and then on again, and see if you can join the webinar with everything working. Now, due to the timings today, we're not likely to be able to take more than a short number of questions, relatively short number of questions, but we will do as many questions as we possibly can. And as I said, the webinar is going to be video recorded and put up on the YouTube channel. So I think that's all my comments before we kick off. Oh, except of course, I didn't tell you that I'm Chris Todd, and I was the director of the Older People and Frailty Policy Research Unit, and I'm now the deputy to Barbara Hanratty in Newcastle, who directs the Healthy Aging Policy Research Unit. So, no further ado, and I will hand over to Danielle Harris, and you can see her title there, and hopefully everything will run smoothly with the technology. So over to you, Danielle.
Thanks, Chris. Hi, everyone. I'm Danielle. I'm a final year PhD student. My PhD work is focused on developing an intervention to increase physical activity in older adults from lower socioeconomic status groups. And today I'll be talking about one phase of this work, which explored the effectiveness and acceptability of existing physical activity interventions amongst older adults with lower socioeconomic status. So first, just to give a brief outline as to the rationale for this work. Well, why is this work important? We know that socioeconomic status encompasses different factors such as income, occupation, education, and the areas in which people live, and it's a key determinant of engaging in physical activity. Individuals with lower socioeconomic status tend to have lower levels of physical activity compared to those with higher levels of socioeconomic status. And what's more, socioeconomic inequalities in physical activity levels widen with increasing age. So older adults with lower socioeconomic status are an important intersectional group to look at with regards to physical activity. So research shows that older adults with lower SES are less physically active compared to older adults with higher SES and are therefore at risk of the poorer health outcomes associated with this. Older adults with lower SES therefore represent an important target population for public health interventions aimed at increasing physical activity. But in order to develop appropriate interventions for this group, we first need to understand what works, i.e. what's effective, and whether these meet the needs or are appropriate, i.e. acceptable to this group. So the aim of this work then was to review and synthesise the evidence regarding existing physical activity interventions amongst older adults with lower socioeconomic status in order to inform future intervention development. So this review aimed to answer 3 research questions. So firstly, how effective are physical activity interventions at increasing levels of physical activity amongst older adults with lower socioeconomic status? Secondly, what factors are associated with the acceptability of physical activity interventions amongst older adults with lower socioeconomic status? And finally, what are the implications for developing physical activity interventions for older adults with lower socioeconomic status? So I'll now touch very briefly on the methods for this review. So in terms of the key inclusion criteria for studies to be included in this review, the population of interest were community-dwelling older adults aged 65 years and over from lower socioeconomic groups. For the purposes of this review, we kept this to a broad definition to encompass different socioeconomic factors. So study authors' descriptions were accepted. So where studies described a population of lower SES or socioeconomically deprived or disadvantaged, we included these. Studies with any intervention aimed at increasing physical activity were accepted. There were no limits on the type of physical activity or how interventions were delivered. Outcomes of interest were change in physical activity levels, so as measured via objective or self-report methods, as well as measures of acceptability. So this included measures of participant experiences and attitudes towards engaging in the interventions, gathered via surveys, interviews, and focus groups. So now onto the main results for this review. So 30 studies were included in the review in total. 2/3 were from the US. There were over 6,000 participants across the studies, of which 70% were female. So with regards to the first research question, looking at the effectiveness of physical activity interventions. So mixed effectiveness was found on change in physical activity levels. Positive effects were found for increases in walking. However, this tended to be found for walking for a purpose, such as transportation, rather than walking for leisure. Mixed effects were found for objectively measured physical activity. So some studies showed positive effects in terms of increases in moderate to vigorous levels of physical activity, whilst others reported no effect. No effects were found for self-reported total physical activity or for time spent doing muscle strengthening and flexibility activities, but it should be noted as well that studies were of low quality. So with regards to the second research question, looking at what factors were associated with the acceptability of physical activity interventions, we identified 3 themes. So the first theme was that engaging in physical activity offers many benefits. So participants talked about the many different benefits they gained from taking part in physical activity interventions. So this included sort of the physical health benefits, such as increased strength, energy, mobility. But participants also talked about psychological benefits, so improvements in mood and confidence. And they also talked about social benefits, so meeting new people and making new friends. And some of those connections actually extended beyond the interventions themselves. And also participants described how it was never too late to obtain these benefits from physical activity, even at their time of life. The second theme was that social familiarity is important. So this was something that was really important to intervention acceptability. So this extended beyond making those social connections as described in theme 1. Being in a familiar setting amongst peers and sharing characteristics with others taking part in the intervention really helped to facilitate engagement. And this also extended to those who were delivering the intervention. So having instructors that participants could relate to was really important to engagement, and peer leaders were often seen as an effective solution to this. The final theme was around interventions must be compatible with our lifestyle. So participants describe their needs and preferences for engaging in physical activity interventions. Factors related to the intervention setting itself were really important. So having locations that were convenient and easy to get to really facilitated engagement, whilst long travel distances were a barrier. Cost was also a really important factor. So both in terms of the cost of the physical activity sessions themselves or the cost of getting there. Providing sessions free of charge really helped to facilitate engagement. Participants often cited time as a barrier to engagement, so this included competing demands such as caring for others and attending medical appointments. And combining physical activity alongside other activities that people were already doing helped to kind of overcome these time barriers and help to make more efficient use of participant time. So based on the findings of this review then, we propose 6 implications for the future development of physical activity interventions that are acceptable amongst older adults with lower socioeconomic status. So physical activity interventions amongst this group should look to foster social connectivity. They should look to emphasise the benefits of physical activity, so not just those physical health benefits, but also those psychological and social benefits. They should look to combine physical activity with other activities that participants are already doing in order to make more efficient use of participants' time. They should look to minimise cost to participants, so for example, by providing activities free of charge, but also helping with travel costs to get to sessions. They should consider holding interventions in locations that are easy to get to and are already familiar for participants. And they should consider using peer leaders to deliver the interventions. So if anybody would like any more information regarding this review, the paper's been published in the International Journal of Behavioural Nutrition and Physical Activity, and there's a link and a QR code there to that. So thanks so much for listening today. If anybody would like any more information about this work, please don't hesitate to get in touch. My contact details can be found on the slide.
Thank you very much. Thanks very much, Danielle. I see that you're getting plenty of claps and hearts. Well done. So, has anyone any questions? Now, I can't, of course. Somebody's saying sound is not on. I imagine other people can hear me speaking. Yeah. Okay. So I'm slightly thrown by that. Has anybody got any questions what I'm asking? So I can't see the Q&A, but I have seen a question here. Jane, I'm not sure if it's her question or if she's repeating it. You mentioned having a broad view of lower socioeconomic status for inclusion. Did you see any differences in those with lower background education versus those who happen to live in areas of deprivation, higher deprivation? So I guess really a question about ecological versus personal.
For the purpose of this review, we didn't sort of explore that to that granular detail, but I think that is something to look at, obviously, in terms of whether people's individual socioeconomic status compared to sort of their area level is more important. And I think that's something that does warrant a lot more looking at with regards to physical activity.
Yeah. Actually, that question was from Dawn Skelton, so I thought, thanks, Dawn.
Thanks, Dawn.
So James McInnery has asked, what are the interventions? What sort of interventions did you find in your review?
There was a really varied type of intervention. So there was a lot of strength and balance things in there. There was Tai Chi, yoga, dance. There was also a gardening intervention as well. There were interventions that were sort of self-directed, but there were ones that were kind of a lot of group-based sort of formal physical activity classes and things as well. So there was a real variety.
Okay, thanks. In the absence of me being able to see other questions, I was going to ask you, did you find any other factors of importance as well as socioeconomic status? So an obvious possibility was ethnicity. So
so we did explore ethnicity a little bit further in this review. So there were some studies where there was sort of a high ethnic diversity sample, or the majority were ethnic minority samples. And when we were looking at acceptability, we compared those with the studies where there was a predominantly sort of white sample. So we didn't actually find too much difference in this review. There was only actually one study where participants from ethnic minority backgrounds sort of cited that obviously speaking to someone of a different race was a barrier to them kind of engaging with the intervention. But yeah, that was the only sort of difference we found with this review.
Okay, and Barbara Hanratty has asked, obviously this review is looking at lower SES status, but could the findings actually also relate to people from high socioeconomic status?
I think there are certainly some things in there that are sort of similar to obviously higher SES as well. Interestingly, one thing came out, it was more to do with kind of being with those people that shared characteristics of not just being with older people, but also people. There was one intervention that was done in a bingo club, and just having people there that they knew, from a similar background to them, that was really helpful to engagement. But yeah, I think there are obviously a lot of other things that do apply to higher SES as well.
Okay. And Oliver Souters asked, could the priority be developing a new intervention or adapting existing ones to make them more accessible to those people from lower SES groups?
Yeah, I think sort of, well, with the further work that I've been doing, rather than kind of creating a new intervention from scratch, I am actually sort of adopting something that's already been done before, basically. So a lot of the things that come out from prior interviews that I've done after this study, basically finding that there's a lot of things around the messaging towards physical activity is kind of not getting through to this population, particularly around sort of physical activity being something for leisure and to do for fun. So that's something that we're working with now with this group to kind of adapt. How do we adapt the messaging and make physical activity, seem something that's fun to do for this population?
Okay, and final question from Gillian Cohen, who says that you mentioned the vast majority of the participants in these studies were women. So
Yes.
did you explore the differences between uptake between men and women? And I'm going to add slightly, do you think these that you have to do something very specific for men rather than women?
Yeah, so within this, we didn't explore it in that granular detail here, but the interviews that I've done after, so basically I've managed to get gender parity in my sample, so I'm exploring those differences a little bit further with regard to sort of the acceptability of engaging in physical activity. So that's something that I'm looking at with the next study that I'm doing.
Okay, well, thanks. I've got a naughty question, last final question. The majority of your papers, I think they were 1997 through to 2023, is that right? Do you think things have changed following the COVID pandemic, or is it not possible to say much about that?
Again, that's interesting that you asked that, because that's coming out of the interviews as well that I've done after this work. So with regards to this review, all of the data was actually collected prior to the pandemic. So even though the studies were sort of published in 2023, most of the interventions were conducted sort of prior to the pandemic. But yeah, with the interviews I'm doing, I'm looking at the acceptability of engaging in physical activity sort of since the pandemic to see if there's been any change. And what we are finding from those is that COVID-19 seems to have been a teachable moment for some people. So some people have sort of, the pandemic has made them be obviously an increased sense of importance of their health, and in turn physical activity in that. So it hopefully seems a good time to act now in terms of physical activity for this population.
Thank you so much, Danielle. Really interesting talk. And I'm sure everyone would like to join with me in congratulating you. So well done. And I'll do the claps for everyone. Now then, let's turn to our second speaker, who's Lily Mott. And I think Lily's just going to put her slides up. And Lily's going to be telling us about interrupting sedentary behaviour in older home workers. And it's a theory-based qualitative exploration. So that's looking good, Lily. So if you're happy to make a start, please do. Thank you.
Yep, great. Hi everyone. My name is Lily. I'm a third and final year PhD student. And today I'm just going to be talking through the first study of my work, which was all about interrupting sedentary behaviour in older home workers. So the overall aim of my PhD was to design an intervention to help older employees interrupt their sitting when working from home. And to do this, I conducted two main studies. The first one was a series of interviews with older employees to really understand their sit-in behaviours, which is what I'll be going through today. And then the second study was a series of co-design workshops to help come up with an actual intervention in response to the barriers that were identified in the first study. But first, just want to do a little bit of background about why this intervention is needed. So sedentary behaviour is characterised by very low levels of energy expenditure, while someone is in a seated, reclined or lying down position. And this is something that we engage in every single day, whether it's sitting and watching TV, sitting and driving a car, or working in a desk-based job. And we know that for those who engage in prolonged bouts of sitting, so maybe 30, 40, 50 minutes at a time or hours at a time without moving, there are increased risk of adverse physical and mental health. And desk-based workers are a particular risk, and studies have found that they can spend up to 82% of their working day seated, and this often does take place in long, uninterrupted bouts. So we know that occupational sitting poses a real health risk, and employers do have a responsibility to protect their employees from these risks, and workplace interventions are a really good way to do this. So why am I focusing on home workers in particular? As you'll all know, following on from COVID, a lot of people now work in a hybrid way, spending all or part of their working week working from home. And the graph on screen is from an ONS survey, and it shows the levels of hybrid working are actually on the rise. And more broadly, home working or flexible working is actually now expected by quite a lot of UK workers, which was in the same ONS study. And we know that high levels of sitting continue to be seen in home workers, and there is a lack of research exploring the home working environment. And finally, why am I focusing on older employees? 1/3 of the UK workforce are now aged 50 plus, but they do remain a neglected population in workplace research. And it's really important to consider older employees as a subgroup of population because they do face unique challenges compared to their younger colleagues. And that can be in terms of experiencing health challenges or concerns, having caring responsibilities, or experiencing age discrimination. So workplace interventions that cater to older employees are really important and can help older employees remain or return to paid employment for continued economic activity. I'm just going to very briefly go through my methods. I think Linda or someone is putting in the chat a bit more detail about the behaviour change wheel. It's very complex, so I don't have too much time to go into it, and there's a lot of content out there if you do want to get some more information about it. But very briefly, the behaviour change wheel is a framework for designing interventions, and at the centre of the behaviour change wheel, which you can see in green, is the COM-B model. And the COM-B model argues that in order for a behaviour to take place or to change, someone needs to have the capability to do so, the opportunity to do so, and the motivation to do so. And it's these three factors in combination that result in a behaviour taking place or changing. So the behaviour change wheel recommends using the COM-B model to understand what actually needs to change when we're designing interventions. Once you've done that, you can then look at the rest of the behaviour change wheel and use certain intervention functions, which are shown in red on the middle circle. So, for example, should we use education to deliver our intervention, restriction, modelling, and so on. And where possible, you can also use policy categories, which are on the outer layer. So we can issue guidelines, legislation, or fiscal measures, and so on. The behaviour change wheel is a really comprehensive and systematic approach to behaviour change design. And like I said, it guides the user all the way from stage one, understanding the behaviour, all the way through to making decisions about what that intervention is actually going to be made up of and how it can be delivered. But this study, which I'm going to go into now, is very much focused on identifying what needs to change. So, the aim of my qualitative interview study was to understand the barriers and facilitators to interrupting sitting in older employees who work from home. To do this, I recruited a local council in Greater Manchester. I conducted 22 interviews on Zoom, and I used reflexive thematic analysis to develop 6 core themes, and I'm just going to go through each of these themes now. So theme number 1 was that there was ambiguous knowledge about sedentary behaviour. So people weren't really too sure on how to define it, and they weren't necessarily sure on the associated physical and mental health risks. They knew it was bad, but they couldn't really articulate why. People also didn't view sedentary behaviour as its own distinct behaviour. They associated it quite a lot with being physically inactive, which it isn't the same as. So someone can be highly sedentary in their day-to-day life, but also engage in sufficient levels of physical activity or not, and those behaviours do coexist. And people also had a belief that you could engage in compensatory behaviours. So, for example, it's okay that I sit down all day because I go for a walk at lunchtime. And whilst that's obviously good because we want to increase our levels of physical activity, we also need to make sure that we're reducing our sedentary behaviour and interrupting that on a regular basis. And those two things should happen alongside each other instead of replacing one another. Theme number 2 was that people felt the nature and demand of their role was in conflict with change. So, as desk-based workers, they thought, sitting is an unavoidable component of my job. They had high workload and they just didn't really see how can I interrupt my sitting when sitting is part of my job and completing that. People also had quite negative emotions associated with interrupting sitting. So people had a real concern that they would lose concentration and that their productivity would be impacted negatively if they were to regularly interrupt their sitting. And with the rise of home working came the rise of online meetings, and that was a major barrier for people in terms of interrupting their sitting. Theme number 3 was that there was a lack of conscious action in relation to sitting. So sitting is a habit and it's usually a secondary action in response to doing a primary action. So for example, I'm going to assume most of you are sat down, but that's because you are watching us present at this webinar. And well, before I started presenting, you probably weren't thinking about your sitting. So it's something that people forget about. And that very much came up in my study. People just weren't thinking about it. They were engrossed in their work and would forget to move. When people did interrupt their sitting, again, they weren't interrupting their sitting to interrupt their sitting. They were doing it in response to a specific need or a random trigger in their environment, whether that was making a brew, making lunch, the doorbell went. It was very random, which would often result in people sitting for prolonged periods of time. Theme number 4 is that health can be used as a potential motivator for older employees. So health was really central to the older employee identity and experience, and most of my participants experienced some kind of health challenge or concern. And there was a real desire across the data set to protect that health in the years prior to retirement. And there was also a concern about, how can I manage my health and continue to work in those years prior to retirement. And flexible working for some people did come up as a way that they felt that they could manage that more easily. Theme number 5 is that there is hope for targeting workplace sitting at home, and this is in conflict to theme 2, which spoke about the conflict. But people were aware that there were positive emotions and benefits to be had from interrupting their sitting. So, for example, when I stand up, I feel more energetic, and vice versa. When I stay seated, I feel tired and lethargic. Participants did also believe it was realistic to regularly interrupt their sitting, and that was especially once they understood that we're talking about very, short micro breaks, so 30 seconds, a minute at a time throughout the day. We're not suggesting that you go for a walk every hour. It's very much interrupting the sitting, and people felt that was realistic. And also trust was an important component here. So feeling trusted by your employer was key to having that perceived autonomy over taking control over your sitting and activity behaviours. And that was linked to being at home for some people. So, I'm at home, who can see when I step away from my desk, and that was quite important. And then the final theme was that interrupting sitting was not actively embedded in home working culture. So as we know, interrupting sitting is usually not normal in online meetings, and that meant that people felt quite tied to their desk. Also, meetings were back to back and would run over, which would limit the opportunity to take a step away from the desk. There also weren't any policies or initiatives targeting sitting behaviours when at home, and in conflict to what I just said, some people did feel there was a lack of trust with their employer, so that they felt guilty when they would step away from their desk. And that brings up the presence of subcultures even within teams. So it really was dependent on what team they were working in. Obviously, when we work from home, we do work in silos from one another, which makes it a bit more complex. And yeah, there was just a general lack of encouragement to move when people were at home. So in conclusion, sitting behaviours are influenced by a really complex web of factors, and a lot of these were relating to motivation and organisational culture. For older employees specifically, targeting health could be used to motivate their behaviour change. But overall, there is just a need to design suitable interventions to help those who work from home interrupt their sitting, and these should, if possible, be low cost and be able to be digitally delivered to ensure that most people who work from home can benefit from these interventions. But yeah, that's everything. Thank you. And if anyone has any questions, let me know.
Thank you very much. And again, well done. It's good to see how your work is progressing. So, I haven't seen any questions appearing in the chat yet. Oh, Dawn Skelton, did you speak to the co-creators about their experience of co-creation? So did you sort of do any reflexivity on the method?
Yeah, so I did. My second study was a series of co-design workshops, and I evaluated that process as part of that study. So I used the LEASC guidelines and made sure to send out anonymous surveys after each session to make sure that they had feedback from that. And prior to this study, I did also do public engagement with my public advisory group to kind of go through the questions. So yeah, they were very much involved in the process.
Okay, another comment from Dawn. Did they feel any of their ideas might actually get into practice?
I think so, yeah. I had quite a lot of positive feedback from the co-design workshops, and I did 6 workshops, so it very much was an iterative process where they would feed ideas in, I would map that back to the behaviour change wheel, we would then have subsequent sessions, and in that process I did involve senior leaders as well. So I'd like to think that they did feel that their ideas were involved, and they were in the final product, yeah. I think Chris is frozen.
Hi, Lily. Yes, I think he has frozen. Perhaps he'll leave and rejoin. I think I'm just looking through the meeting chat to see what other questions
just step
there
in while
are.
Chris is frozen.
Oh, thanks, Jen.
I'm just trying to have a quick look. So we've got one here from, I think it's Lauren, is it? Yeah. Lanis Hassan. So when you talk about interrupting sitting, what kind of behaviour do you actually mean? Is standing up once in a while enough?
Yeah, so it's literally the interruption of sitting. I mean, sedentary behaviour is also characterised by low levels of energy expenditure. So I know a lot of office interventions use sit-stand workstations, where obviously people are then standing. Research indicates that obviously standing is better than sitting, but you can also be stood for a really prolonged period of time and not necessarily expending that much energy. So it's about some kind of low level of physical activity. So that can include walking across your room, up and down your hallways, taking the stairs. So standing is better than sitting, but preferably it's kind of some energy expenditure. And that usually is classified as light, intense physical activity, which does just include like pottering around your house or your flat and stuff like that. So yeah.
That's great. Thanks, Lily. So more than just standing up, which is what I did when I was watching your seminar immediately. I repressed through it. Chris, I'm going to pass back to you because we lost you then for a second. We're up to Liz Murray in the chat.
Okay.
She's talked about hanging out the washing. So maybe it's David. Deborah David is next.
I can't. Oh, Liz Murray. Okay, Deborah. Many people at home and working, but with musculoskeletal issues. So have you got any ideas about appropriate exercises, activities, movement for them? And do they need extra active encouragement?
I'm not sure whether they need maybe additional encouragement. I know that came up a lot in my study. Like I said, most people did have some kind of health concern or challenge, and MSK is a major issue in terms of ill health at work as well. I think it's about developing interventions that are obviously realistic and feasible to do whilst you're still obviously at work. So, we're not talking about doing, major periods of activity here. It is just making sure that where you can, you interrupt that sitting. So like I said, it can be standing, that is better than sitting. But, it could be just taking the stairs or maybe people do squats or lunges or heel calf raises, and there is emerging evidence about fidgeting, maybe whilst you're still sat down. So there is something called, like active sitting. There's not enough evidence yet to really say if that's better, but I think it's an interesting, potential future research. Yeah.
Okay. Thanks. As you can see, maybe I'm standing now. I don't think that had anything to do with me dropping out, but it was to do with your seminar reminding me I must stand up, and I've got a standing desk, which makes it much more easy for me. Many organisations and universities publish co-creation interventions, but they've just had 1 or 2 workshops, and you've had more than that. So what are your thoughts about the trustworthiness of just very small numbers of workshops with employees? And I should say that Dawn and I sit on a committee together, and she's in charge of asking the co-creation questions. So I can see where she's coming from now.
Yeah, it's obviously difficult to say. I think it depends on what you're researching and who that group is made up of, and if it's a representative group of obviously the target population. I think as long as you're following some kind of co-creation or co-design guidelines, and that there is some level of iteration, and again it obviously depends on your methods. Obviously I chose to do more workshops so that I could ensure that previous feedback was in subsequent sessions. I think it's maybe also important to maybe just get different views. So even if you can't have more than 2 workshops with your main co-creators, I know for me it was important to make sure that senior leaders and managers were involved in a separate workshop to kind of have those complementary views. But obviously it's difficult because it also is really time consuming and budgets are limited. So it depends on a lot of factors, but the more opinions you can get from trustworthy sources, I guess, is beneficial.
Okay. That sort of makes me think about the question as well. Sort of, what about the organisational cultures of these sort of enterprises, public sector employers? So, how do you think we can go about changing them to bring about these sorts of necessary changes? What do you think you can do?
A big question. I think they are critical to the success and implementation of workplace interventions. We can't do this without them. And yeah, it is a very difficult one to answer. I think a lot of it's maybe about education of the benefits that obviously this can have for employees, in terms of, we need to be moving more towards better work-life balance and more positive workplace cultures, but also benefits for the employer. So obviously ill health, especially in the 50 to 64 age group, is the biggest reason for exiting the workforce early. And one of the most important factors for that age group returning to work is having flexible working arrangements and flexible hours. That's from the ONS survey. So, in terms of staff retention and staff recruitment, and reducing sick leave and productivity is quite difficult to measure with this stuff, but I think, there's benefits to the employee and the employer, and bringing them along with us as collaborators is really important, because there are benefits to everyone, and that's, I think, the way the world is moving as it should.
I'm a bit aware. I am aware of the time. We've got a few minutes yet, but there's a couple more questions I think would be useful to just have a word about. Liz Murray said she wondered whether linking to the Sport England We Are All Undefeatable campaign would work to help this population people. So have you any comments on that idea?
I don't know what is it, the We Are Undefeatable campaign?
Yeah, so it's a campaign for women, isn't it, specifically aimed at women being more active?
I think anything that is kind of a holistic approach to people being more active, both in and outside of work, is positive, because like I said at the start, in terms of the background, it's about both and behaviours in conjunction with one another. We should be increasing our physical activity, but making sure that people know that that's not a replacement for then prolonged sitting, and it's kind of trying to target both of them and trying to make it clear that sitting and sedentary behaviour is its own behaviour, but sitting does displace time that people would spend being active. So they are very closely connected. So yeah, I think anything related to that is definitely positive.
I'm being corrected. It's for people living with long-term conditions, not gender specific. I'm thinking of a different Sporting England campaign. There's a couple of final questions. So I mean, Dan Barlow was asked, in terms of online meetings, was there any conversation about doing these on smaller mobile devices, like on their phones, so that you could walk around whilst being part of a meeting?
Absolutely. I think I know I did that during COVID. A few people tried to do walk-in meetings. What I did during my co-design workshops, which people felt worked quite well, was when it was an hour long, halfway through we would have a 30-second, oh no, it was a 2-minute movement break, and it would just be an opportunity for people to step away from their desk, and integrating it into the meeting and having it on agendas, on PowerPoint templates. Because I know some people suggest maybe doing shorter meetings, but then there's no guarantee that people are actually then stepping away from their desk. It's just another opportunity to carry on working. So, you know, having an opportunity where people can just move away from your desk, and, you know, you can turn your camera off, you don't have to dance in front of people, but it's just that opportunity to step away. And it being modelled by whoever's running a meeting would be obviously really useful, and seeing other people do it, I think, embeds that behaviour change over the long term.
Well, thanks, Lily. Hannah McGurk has asked if there's any papers that could be shared with people on the topic. And I know that annoyingly we are still waiting for some papers to come out. But I'm sure that we will be able to share papers in the very near future. And of course, the slides and maybe some specific papers can be shared through this webinar series.
Mm-hmm.
Okay. Right, I think I have to draw this towards an end. I know that there are people commenting in the comments, and these will all be part of anyone who hasn't been answered. We will answer specifically in the next few days, and of course this will be available on our YouTube channel for fairly soon. I'm not sure exactly how quickly it goes up. So thanks very much to both our speakers today, and well done. It's been very interesting to hear your work. Thank you both. Now then, just before you all go away, I just want to remind you that this is part of a series of webinars. We will soon be putting up the dates of our upcoming events. Yep, so it's just gone up. Upcoming events are going to be listed on our website. And as soon as we've organised the next couple of webinars, we'll be making sure that those are public. You'll be able to look at the whole series so far on the YouTube channel, which I've got, and you can link through our website. So thanks very much for coming. Hope it was informative, enjoyable, and that a lot of you actually got up when Lily was speaking and realised it was possibly a good idea not to be sitting all the time. So well done, both of you. Thank you very much, and good luck with your PhDs, which I know you're both in their 3rd years, so coming towards fruition. So thanks so much, everyone, for coming, and have a good afternoon. Bye-bye.